Welcome, everyone. We're going to jump right in today, and I'm sure that some other folks will join us as we are going along. I'm so pleased that we have another opportunity to talk with Margaret Tarmy, RN, and Sally Kirchner, RN, registered nurses from the Vermont Department of Health, the Division of Maternal and Child Health. And also today we have a special guest, the new Director of Programs, Sheila Duran-Lowe, at the Child Development Division. So I'm Brenda Metzler, and I'm a Community and Program Support Specialist with Let's Grow Kids. I'm also going to be the facilitator of the Q&A when Margaret and Sally are done presenting, and sometimes they intersperse question opportunities during their presentation. We will be taking questions that you either submitted when you registered or that you put into the Q&A box while we're meeting. So just a couple of reminders about that. Please, if you need technical support, enter that request into the chat box. And very important that for all of your health-related questions, you use the Q&A. And it's important because sometimes we don't have opportunity to either fully answer or to answer all of the questions that come up during our time together. And if you put your questions into the Q&A, we can capture that, and then we answer them after we're done meeting, and we'll get that posted, and we'll share. I'll repeat that again later, but we make sure that you get the answers. So I think if we go to the next slide, we just have a few more housekeeping details. For best sound quality, everyone is muted except the people who are presenting. And again, the reminder that your questions are welcome. The nurses want to answer them, and please use the Q&A box when you have questions for the panel. So I think with that, we can turn it over to Sally and Margaret, and perhaps also we'll I'm going to let you to sort of introduce or reintroduce yourselves, but also let's give Sheila a chance to introduce herself, and then we'll get going with all the content. Thanks, everyone.
Sure, I'll get started. I'm Margaret Tarmy. I'm one of the nurses at the health department. I've been in the school and childcare branch over the past year, and look forward to this time with you all today, supporting your work in the field.
Right, and I'm Sally Kirchner. I work with Margaret on the school childcare COVID response branch within the health department. And in my other life, I work a lot on issues around childhood and maternal child health injury prevention. But Margaret and I have been working on this for a year now, because that's how long we've been having this pandemic.
All right. Yes. Hi, everybody. Thank you for having me today. My name is Sheila Duran-Lowe, and I am the Director of Programs at the Child Development Division. I've spent most of my career in child protection and early childhood care and education. So I'm pleased to be newly in this role and pleased to be with you today.
Great. So first, just want to extend our sincere gratitude to you all as we carry on another day with COVID-19. It's been quite a year, and you all have been at this for a long time. There's a lot on your plate with trying to follow our guidelines and provide enriching environments for our youngest and most special population, our children. So thank you. Thank you so much. The agenda today is going to be really predominantly focused on vaccines. So that's going to be really the core part of it. We definitely want to chat about the new populations that have become eligible since we chatted with you last in February. And you all included this time around big news. So definitely want to chat about the rollout of vaccine for childcare providers. And we do have just kind of embedded into the presentation quite a bit of really common questions that we get associated with the vaccine and sort of what it all means. So we'll be going through those pretty extensively. And then we just have a few updates at the end about return to play, and definitely want to give an update about summer programming and just the emphasis on social emotional health for children and youth this summer. So yay, happy March, everybody. And Sally's going to take it away with vaccines.
So I'll just go over this quickly. And again, we always say, go back to our health department website, because this graphic is on the website, and Margaret made up nice notes pages for me. And as I'm looking through, it's all on our website. So sometimes I feel so smart and well informed, but it's just because I read our health department website, and which has an awful lot of information on it. So as you folks may know, we started out several weeks ago, actually a couple months ago now, I guess, with the phase 1 and healthcare workers and residents of long-term care facilities. And the governor, with advice from like our health commissioner, Mark Levine, and other top health and epidemiology people in the state, have advised going by the age bands, which is designed to reduce the most severe infections that end up in hospitalizations and ventilator use, and also to reduce the number of people who are going to die from this. So it was pretty much that moral overlap that the governor decided to go with the most high risk individuals by age band. So we started with, was it over 70? Now we're in over 65, and going to the certain high risk health conditions, and 16 and over with high risk health conditions. And then even tomorrow, the governor may announce that individuals 60 and over will be eligible. And some of this is, as I say, people who are eligible, reducing the number of severe cases and deaths. And it's also a juggling with how much vaccine we have from the federal government. And that's been rolling out much more quickly than we anticipated. And also with that large amount of the extra Johnson & Johnson, which like in January, we didn't expect or didn't know if that was going to come, that allowed the vaccination program for K through 12 teachers and childcare staff. So that was really welcome news when that was able to happen. So that's a quick explanation of that. Maybe the next slide. And this is on our website, and I know you've been receiving a lot of information from CDD and Sheila and her colleagues about how who's eligible and how to get to a clinic and get vaccinated. This again is on our website and CDD about individuals who work in regulated childcare programs. And the idea is, because we do have limited vaccines, so the first swath of immunizations, if I can use that term, is for people with direct contact with children. So registered licensed family child care, teachers, aides, other types of staff that interact with children. And so that's that paragraph there that you folks are probably pretty familiar with by now. And then this coding system, Sheila, I would think it was pretty hectic in your offices and also with the AOE people in setting up really fast that system of codes and associated it with ability to access the vaccine clinics and getting an appointment. But it's my sense it's up and running, and people are signing up. We got a notice through the health department today that some of these clinics still have openings, and we're to be encouraging teachers and childcare providers who are not signed up to call the health department and get on the website and sign up.
Yes, thank you, Sally. I do. Is this the place where you want me to share some information? Is that okay now?
Yeah, it makes sense to me.
Okay, all right, great.
Okay.
Thank you so much. I do want to let people know that every single morning at 9:30, me and some of my colleagues join AOE and the emergency operations team to problem solve this, this process. There are a lot of moving parts, and it's a very complex system which I never would have thought of before I started this effort. It's a very complex system to know how many doses we're getting in the state and where they're coming to, and then develop clinics and staff clinics and get doses in the arms of all our Vermonters. So I have a new appreciation for the people who do that work, and thank them very much. But as we are talking, I also am developing an email blast to go out to everybody who receives CDD emails about the clinics that Sally just mentioned that are coming up and that they still have slots. So please be looking for that email. The schedulers do try to schedule new clinics anywhere between 4 and 5 o'clock in the early evening. But if they get a clinic that pops up after that time, they're going to schedule it in the morning because they don't want to wait another 24 hours to open it up for people. So anytime you can go on and look, or have a family member go on and look for you, or have somebody that somebody in your program, maybe in the business office, perhaps, who sits, at their computer, if they can be actively looking, at least, around after 5 and maybe 8 or 9 in the morning, that might help you with scheduling. We are working with the schedulers to have clinics open later in the evening. I think the ones that you're going to see that we send out today, there's some that are open until 6 o'clock. And I think there were 2 that were open until 8. But we have helped them understand that childcare providers and educators, are working during the day, and it's difficult for them to oftentimes go to a clinic in the afternoon, unless of course you can stagger your staff and accommodate that. I don't think I really have anything else to add. We're hoping that all childcare providers and educators get vaccinated as soon as possible. If there's an open slot, and you can make it, please take it. If something else opens up before your appointment comes, go ahead and register for something else that might be better suitable for you, but please make sure that you cancel anything that you had previously signed up for. And then of course there's the pharmacy, there's the pharmacies as well. I don't know how many people are using pharmacies, but if you have an opportunity to use a pharmacy, please take advantage of that. I think that's it, unless Sally and Margaret, did you have anything else that you had hoped that I would address?
I think that is immensely helpful, Sheila, to hear your input. So thank you.
You're welcome.
Yeah. So I don't know if Brenda, if Sheila wants to stay, if Sheila, you need to leave, or if there's any questions specifically that we should grab Sheila for before she heads out. I don't know how you'd like to work that, Brenda.
Well, I guess I'll leave that up to you, Sheila. Thank you so much. It's really nice to have this opportunity to meet you and to hear from you. And I would just point out that when everyone has access to these slides when we're done here, that Sheila's email address is right there. And also, I would just remind you to keep your eyes open, because I think that what we're going to hear from you, Sheila, will be very informative. And so when that email blast goes out, it's going to be like up-to-date, helpful information for everyone. You are welcome to stay. And if you have a long list of to-do things, you are also welcome to leave at this time. So thanks again for sharing.
All right, thank you, Brenda. I will stay so that in case questions come up, I can answer them. So
yeah.
Great. Thank you.
You're welcome.
Thank you. So just this next slide, this tips for making a COVID vaccine appointment. When you do get the slides and they're uploaded, is a hyperlink that is a step-by-step process of registering yourself on the health department website. If you've already been tested at any of the pop-up sites in the past, you're already with a contact, you're already registered, and that's really the first step to get registered, and then you can make an appointment. The other thing that's on this slide is I did add the URLs to the various vaccine fact sheets for Pfizer, Moderna, and Johnson & Johnson. So, this is the fact sheet that is typically given out when you get an immunization. It's part of explaining more around possible side effects, when to call your doctor, what's it indicated for, things like that. So just to kind of take a look ahead, as far as our vaccine campaign goes, as Sally was saying, it does sound like the press release tomorrow is going to be largely on vaccines. So if you can tune into that, there will be more information forthcoming on our whole vaccine campaign, which is evolving every day. It does seem that next, people who are 60 years and older are expected to be able to make appointments. There's also efforts to vaccinate the BIPOC community. And last I knew, it was anticipated that the general public would be eligible in May. Now, something I wanted to just kind of bring up, as Sally and I have taken various calls on our call center, and Sheila, feel free to chime in, but certainly we've received a lot of callers who are maybe providing wonderful programming for our youth, but may not be a licensed or registered care provider through the Department for Children and Families. So at this time, the only people who are eligible for registering for vaccine are people who are either a licensed or registered provider in the childcare world with Department of Children and Families. There's been certainly other conversations occurring, with Vermont After School, and we certainly recognize that the people who are providing all sorts of after school programming and summer programming, which is critical, might not be, there's my kitty, in this group at this time. And, we hear that when there was movement to go forward with being able to roll out vaccine to registered care providers, we needed an N. We needed to know how many so we could factor that into the equation. So that's where we started. So I just wanted to acknowledge that we're really excited that we are at this stage of the game. We're delighted that our distribution of vaccine is going well, and hopefully there will be even a larger rollout. But at this time, the vaccine is only for those providers we've talked about.
Yeah, and Margaret, I can just follow up a little bit on that as well. And certainly everybody understands that there are people who are not regulated that are very vital to the early care and education, and school age care as well. But in order to actually be able to match doses with numbers, we had to go with a group that we knew about and that we were able to communicate with. And we don't know about all of the unregulated programs, and we don't have a way to communicate with them. And so this was the strategy that the state operations team developed so that we could match. We needed a number, and we needed a communication strategy. So hopefully if the governor talks about 60+ age band next, and then we have the 16 up with underlying health conditions. It's pretty exciting, I think, that Vermont may be fully vaccinated within a couple of months from what we hear. The prediction is. So we certainly all acknowledge that the regulated phase, it certainly has excluded people who are very deserving.
Thank you, Sheila. So the next couple of slides are just some common questions that we get, which we thought would be worthwhile to go over. So, the question here is, do I need to wait to get my vaccination if I'm either under quarantine or maybe I'm sick with COVID? And you absolutely need to wait if you are under quarantine after an exposure, or maybe you've traveled. Whatever the circumstance is, that would warrant postponing the vaccine until you are out of isolation or until you completed your quarantine and we know that you don't have COVID.
So, and this is an interesting conundrum of the vaccine, and there are some side effects, such as, obviously a sore arm or some achiness and just no energy, that kind of thing. And some of that the person might start to get worried, like, oh my gosh, I just got my shot and now I'm getting COVID. But obviously, if you're concerned, you can check in with your medical provider. But usually, the COVID type symptoms are mild and go away a day or two after the vaccine. The symptoms from the vaccine, but the COVID symptoms would be different, would linger, or would get worse. So, unfortunately, in the first 24 hours or so, I don't think we've had any problem with people not being able to figure out what it is, but it is a concern and something to think about. So here's an FAQ from our website to help explain that. So, and again, as it says at the end, if the symptoms get worse or continue, to call your physician or healthcare provider. Oh, Margaret, that's yours. Okay.
So this question is, can I still infect someone with COVID-19 after I've been fully vaccinated? So what we know about the vaccine right now is that it can protect you from severe illness, but we are still learning about whether or not it can really prevent, in all cases, people then giving the virus to someone else. We're still learning about how long the protection lasts. And, at this time, we do have a whole lot of faith in it protecting against the new variants, but it's still new and it's under study. So that's part of the reason why we really also want people to keep up their prevention steps, like wearing a mask and staying apart and all that other fun stuff we've been doing for a long time. So that is essentially the main message on this slide. So this next slide is the question, if I'm fully vaccinated, which basically means that you've had both doses. So if it's Pfizer or Moderna, those are 2-shot series. So you've had both doses and it's been 14 days after that second dose, or if it is Johnson & Johnson, which is a 1-shot series, and it's been 14 days after that vaccine. That's what fully vaccinated means. Do I have to quarantine if I have an exposure? So as long as you meet this criteria, meaning that you're fully vaccinated and you've had a complete vaccine series within 3 months of your second dose, and you haven't had any symptoms since this exposure, you do not need to quarantine. It's also noted here on this slide that there is different or a little bit more rigorous guidance if you are a healthcare provider. So this is previously just for your general public that's not in the healthcare workforce.
May I interject a question there for you, Margaret, that has come up?
Sure.
So I think in the veins of this question, there's another question, which is, do you recommend people who are already fully vaccinated being periodically tested?
So that's a great question. And, you know, what I can say is that if you are fully vaccinated, it's not going to have any confusing impact on a COVID test result. That's something I want to make clear. And certainly, you know, if you, I mean, I think the main message here is that if you have any concern for your exposure risk, that, you know, getting tested regularly would be a good idea. So I wouldn't ever want to say, ever discourage that. We have ample testing. I guess it will be interesting to see kind of how surveillance testing evolves over time as we have more people vaccinated. And I guess I'm talking specifically about the teachers. And it does sound like we will maybe use more surveillance testing for other populations in the future. So it certainly can be done. You know, I think bottom line is, but we whenever you're concerned about an exposure or you're not feeling well and it's appropriate, you should get tested even if you've had the vaccine.
I think that clarification is really helpful. Thank you. And do you recommend a certain frequency for testing?
I don't recommend a certain frequency, and I'm not sure if there will be more official guidance on that, as you know, a larger amount of our population is in this group. But I don't believe we have a stance on that at this time.
And
Thank you.
and I'm thinking we'll learn more about that as this goes on. I mean, it says 3 months here on this slide, and they're thinking that's, as research and more people get vaccinated, that's going to go to 6 months and maybe a year of this high level, you know, well over 90% effective. So I think as time goes by, we'll get better answers for people who think, oh, I've been exposed, I should get tested, but wait, I had the vaccine, should I get, you know, it'll become more clear.
Thank you.
Is this me? Yes.
This is you, Miss Sally.
So I'm thinking about the last question, and I'm thinking about, I'm totally off topic. No, I'm not totally off topic. I was watching a webinar last night from the National Academy of Medicine, and they were talking about the 1918 flu and how they did some research on survivors. Like, so let's say a person was 3 or 5 years old and had the flu nearly 100 years ago, and then as like in the when these people were like 90 plus years old, they did some testing of their antibodies, and they were still showing antibodies that they were resistant to that flu from 1918, nearly 100 years earlier. So I know we're talking about vaccine and not actually getting the disease, and but just the human's body's ability to make and antibodies and be able to resist after you've had an infection. It's very remarkable and impressive. Except I'll pull that into this slide. Obviously, some medical conditions make a person vulnerable, and that the basic answer is, if I have a vaccine, should I get vaccine if I have a medical condition? A lot of medical conditions, check in with your physician or healthcare providers, but like many immunizations, the recommendation is the immunizations are safe and get them, because it's more of a chance of a health risk and some negative effects on your health to get the disease than it is to risk any of the side effects from the immunization. So what else does it say on here? So, talk to your healthcare provider. And then with the medical conditions, that's certain people, because of a certain medical condition, are eligible for the vaccine. And that is, the link is there, but that's on our health department website. If you just want to put in the FAQs, I have a medical condition, can I get the vaccine? And it comes up with a list of really specific ones, such as not previous cancer, but cancer that you may be recovering from right now, certain heart conditions, obesity, that sort of thing. And there's a lot of research. They didn't just like make these up saying, oh, that's a pretty good idea, put that on the list. There's a lot of research to help guide this specific list of health conditions. CDC put out a list, and our EPI people and Dr. Levine and all went through it and made sure that that's how the approach they wanted to use here in Vermont. So, so that's the list of the health conditions if that may make you eligible for a vaccine right now, or your family members, and also about the links about if you're pregnant or breastfeeding. The vaccine is, you may take the vaccine, you might want to check in with your physician, but from what we know from the vaccine, people who are pregnant or breastfeeding can certainly consider it, talk to their doctor, and sign up at a clinic after that conversation. Except they can't sign up yet unless they're in the age band, or but that's coming, that it'll be more available for all ages. And then also Margaret put in the health screening questions when you go to a clinic, and some of you may have seen these already. The CDC has this list of health screening questions that you can look at before you go to the clinic if you want to be prepared.
Sally, I was fascinated by what you said about the antibodies, and I'm wondering if you've had COVID. Well, so this is a question that has come up. If you've had COVID, would you still get vaccinated if you are still carrying antibodies?
Yes, even if you've had COVID, we want you to get vaccinated is the recommendation at this time.
Yeah. Oh,
There's one. Go ahead.
No, I'm sorry, go ahead.
So there are a couple of other questions that I think might fit in well right here. One is that someone reports their primary care physician noted that in recent studies, the vaccine in people with systemic autoimmune diseases seems to be less effective. And the question is, do you have any comment on that?
I'm not in a position to address or speak to that.
No, I'm sorry, I don't know about that either. That's a pretty in-depth question, and a good question, a good conversation to have with your healthcare provider, which it sounds like the person is. And I wouldn't know to be able to add into that.
Thank you. I think another one was, you know what, I'm going to hold these other ones because they're a little off topic for now, but we're going to get to them later. So I want to let you carry on.
Sure, yeah, I certainly know we want to address these vaccine questions. So I think there's just a couple more here. Sally.
Yes, thank you for the prompt. Do I need, these again are on our FAQs on the health department. I keep on our website. I keep talking about our website. So I'm vaccinated. Do I need to quarantine if I travel to or return to Vermont? And here's some information to help answer that question. If it's been 14 days since your last vaccine dose, like with the Johnson & Johnson, it's just one dose, with the others is 2 doses. You don't need to quarantine when you travel or return to Vermont, but carry along your vaccine card. They're not quite sure if you're going to be asked to show it. I mean, they're not talking about border stops or anything like that, but it's interesting because a lot of you, those of us who, in the past, who may have done a lot of international travel, if you go to certain countries, you need to have certain vaccines to get into that country, and you do get a vaccine card when you that you like keep with your passport to help get into some other countries. So this is a little like that system. It's not, may seem a little bizarre to have that to get in and out of Vermont, but it's a system that's been developed for other types of travel. Anyone who's not vaccinated and travels with you will still need to quarantine, which makes sense. If you're vaccinated, you're protected against the COVID, which is the whole purpose of the vaccine. But then other people, especially children who can't get vaccinated yet, will need to follow these the travel and quarantine guidance that we've been following for the last many months. And again, there's information on the website about if you have visitors coming into your home. A lot of it you've heard, a lot of it you folks on the front line have helped to actually kind of enforce, because you know what your families are up to, and if they're traveling around and coming back and unsure as to whether they need to quarantine or not, you've called us and we've talked about it, and you folks have become expert on a lot of these guidances.
I just wanted to add that on that last slide, the hyperlink, do I need to quarantine if I've had COVID or the vaccine, is really handy. So I just encourage you to click the link once we get the slides. Okay, so this is another nuanced thing that's evolved over the past month. So the Agency of Commerce and Community Development is ultimately the jurisdiction over the travel, and so pretty recently they had this notice, and so if you are one who lives in a border area, so across the borders, New York or Massachusetts or New Hampshire, and you make day trips for your life, going to get your hair cut, or your gym's on the other side of the state. So if you're traveling within 5 miles of the Vermont border to make these essential purpose or certain activities, and this does include worship, going to a gym, getting a haircut, participating in place-based outdoor recreation, you don't have to quarantine. So there's sort of this newer explanation that those things are okay as we are opening this spigot here. And then the next paragraph on here is saying that, however, so meaning different story, if you travel out of Vermont for leisure, so if you're getting on public transportation by plane, train, bus, for non-essential purposes, then the quarantine does still apply if you're not vaccinated. And so this slide is really just kind of reinforcing the message. We've gotten some questions in preparation for this presentation, and certainly within our childcare branch, people are really hoping that they can maybe just lighten up a little bit on our public health mitigation efforts once they're vaccinated. And I guess the main message here is that we are being very cautious, and because of we need more people to be vaccinated, and we're learning more about the protection that the vaccines do provide. It's critical for people to continue to wear their facial coverings and doing all these other things like washing your hands and avoiding crowded places, and things like that. So we got to keep our mask up. Sally, do you want to take this one?
Yeah, I'm sorry, my crib notes are out of order. That throws me. Restrictions on gatherings. Again, more information on our website. I have to fess up, I read through this and I know it makes sense, but you have to read it several times, at least I do, to really understand what they're saying. So again, there's still restrictions on social gatherings. These will be relaxed as more and more people are vaccinated, and we're constantly evaluating community spread, our case count, our positivity rates. But as it says in the slide, you're fully vaccinated, you're fully immunized after 14 days after the final shot. And of course, actually a lot, just in the last couple of weeks, we're hearing nationally about more research on children ages 12 and above, on younger children. So this research is starting, and it will be coming out, and hopefully a vaccine will be available in the next, I don't know when, several months or more for children, and that of course will be welcome. But if you're fully vaccinated yourself and you have children in your child care, those kids are not vaccinated and are still susceptible to the disease. So you think these broad themes, and then it helps to understand such of the following directives, such as if you are vaccinated, you can gather with other fully vaccinated people or households, and you don't need to wear a mask or stay 6 feet apart. But then if you start gathering with unvaccinated people, that's when you need to go back to limiting your social circle, just 1 or 2 other unvaccinated households, still wearing the mask and staying 6 feet apart. And then this is, if you are not fully vaccinated, you may gather with fully vaccinated people. And if they're fully vaccinated, you don't need to wear a mask or stay 6 feet apart. Or if you're gathering with other vaccinated people, then you do have to do the 6 feet apart masks. So it all makes sense, but you kind of have to see it in writing and read through it and think about it to make sure before you start planning social events, or as you're looking at how you're managing your childcare business. So there's that one. Oh. Yeah.
So just want to provide really a brief update on what we're calling return to play post-COVID infection. And I guess, you know, kind of taking a step back, just to sort of just broader infectious disease. You know, there certainly before COVID at times were illnesses that, you know, might have implications for cardiac health. So mono, other things, this is not the first illness out there that we've maybe needed to pay attention to that post-recovery, as far as if, you know, it was a really severe infection and if there was impact for cardiac involvement. So COVID is in that camp. And recently there was several meetings and webinars on this return to play, largely led by VCHIP and our pediatric doctors and cardiology. And there are several more clinical documents that are not part of this webinar that have just recently been created. But the one that I put on these slides is the Agency of Education's return to play guidance that did just come out this week. So bottom line is that, you know, children who are 5 and up should check in if they've had COVID with their managing provider before getting clearance to return to physical activity. And for the children that are less than 12 years old, can return to activity as tolerated after medical clearance by their pediatric medical home. And for, you know, really what this is about is depending upon the severity of the COVID illness. Really, it's all about the partnership with the medical provider to really determine if they maybe need a phased gradual return to play, and potentially if they had really severe illness, then more cardiac evaluation with EKGs and other clinical evaluation tools would be appropriate, and that's all going to be in the lap of the managing provider to make that determination and give clearance about return to play sports or physical activity.
Yeah, and Margaret, I think they're helping to like define physical activity. I'm thinking of just kids running around and playing in the playground. It's not like that. It's more, I mean, obviously, high school kids and sports and that sort of thing is one more extreme physical activity. But it's not just, you know, hanging out and doing the usual good physical activity that kids naturally want to do and that childcare programs promote. And some of this I was trying to think, and Sheila, you may know more, there's this overlap between childcare programs and they have older children. So we thought we'd put that in there because you all may be affected by this. And Sheila, I don't know, maybe on your 9 o'clock morning meetings, you're getting looped into this also. I don't know. I just don't know how much this affects childcare programs that CDD works with.
How much, what affects them?
This guidelines for return to play, which in my mind with childcare, that means kids playing, but this is like sports.
Yeah.
And
I haven't been a part of any conversation. This is the first time I've heard that phrase, return to play. I can follow up with my colleagues to see, you know, how that might impact any guidance that goes out to childcare providers.
Yeah. Yeah, it's just, I know because, well, you know what I'm saying, because childcare programs have a wide variety of ages these days, I guess historically too. But return to play came from with post-concussion and sports and all that's several years ago. And so now they're using it with post-COVID infection. So, right, I don't know if that helps or just makes people more confused. Okay, summer camp. Is that me? Or is that Margaret? Is that you?
I'll go for it, but feel free to chime in. Yeah, the return to play thing, we really it's just sort of an awareness that this has sort of been another hot topic in the world of COVID related to children's health after COVID. So more importantly, it seems, is just all of this excitement around really infusing programming and care for our youth that have really been impacted over this past year with isolation, with, you know, reduced predictability in their schedules, less just regular life, and it's making an impact on them and not really the ways we want it to. So we have really amazing opportunities ahead for our youth, and the American Rescue Plan has availed itself $50 million in Vermont dedicated to learning recovery. So this is, you know, after school programming and summer school programming. So the health department is definitely working closely with Agency of Education, pediatric providers, Vermont After School. Currently the project at hand is to create robust summer programming and camps that really are going to emphasize the social emotional health and care of kids to really build back well-being that's been lost throughout this year. And I guess the other thing I wanted to mention was that Vermont After School just this week is spearheading sending out a survey to anyone who is providing any sort of summer enrichment. And we're in the process of, you know, trying to really have an awareness of what all of these programs are so that people can get plugged in and linked to these opportunities. So that's really exciting.
Yeah, and so again, I see Luann is clarifying for me that you folks, mostly your programs go for early childhood and not a mix of like after school age kids, and also this, I'm thinking again, the summer camp, you would be having just your regular programming would be my assumption of what this is trying to get at is building summer specific programs for kids who are out of school but have gone through this awful year, and these programs having, as Margaret said, an emphasis on social emotional health, not to imply that the children and childcare operators also have not had an awful year. So, and then Sheila, I don't know if that's anything that overlaps with any of your programming or planning, or it's just here it is, and the Vermont After School is working hard with many partners to make robust summer programs for kids.
We definitely have involvement and are participating in the Vermont After School conversations about summer programming and, you know, money, federal money that's, you know, going to be available and coming down. So we're all part of those same discussions.
Okay. All right, that's good to know.
I guess the last thing that is probably we forgot to just mention, which I know you'll all be very eager to hear, is that we are working on revision to the child care guidance.
Oh, yeah. Oh, yeah.
So that is in the works. It's certainly in process. And I know that that's been a just something y'all been very curious about, like when will it be re-updated? So that is in process. We are in the works with that. And the summer guidance as well.
So this is a slide that for some reason got struck out the first time we were going through, and it's back with the Q&A, and it's it addresses some folks curiosity about, so I've recovered from COVID, now what?
Oh, so yeah, Margaret, I think I was going to talk about this, so I'm sorry if I missed it when it went by. So this is, again, like some of the symptoms that you might get after getting the vaccine and feeling a little yucky. It's like, oh my gosh, am I getting COVID, a head cold, or is it just from the vaccine? And the same after you have recovered from COVID. And back to also the question on the testing, sometimes you can test positive for COVID for months afterwards. And this was something confusing to us last spring when this was all unraveling and unwinding, and we were still trying to get good research as to what was happening. So it says there, we don't recommend testing if you develop new illness symptoms, but still, whether you've had COVID, recovered, assuming you're getting some symptoms that may be due to something else, such as a head cold, or I don't know, flu, regular flu. Just because of the guidance for teachers and students, people with symptoms shouldn't be in a childcare program or in a school building. So stay home, monitor your symptoms, and check in with your healthcare provider. And Brenda, I know you have a plan for the last 5 minutes. I saw one question that I thought I wanted to address about folks and concerns about the safety of the vaccines. Is that all right if I jump into that? Yeah, there's a lot in the news about the vaccines. There's a lot of good reporting. I don't mean the definition of good reporting showing that the vaccines are safe and effective. They are reporting that, and that is true. And then you pop up with all the variants in Brazil, and what a mess. And now we're seeing the variants in Vermont, which our health commissioner emphasizes that is expected. And we're just monitoring it. I know our health department lab people are getting special 2-day training to help identify these variants. So Vermont is being sure that we can respond to this. Then the other day, a couple of, like last week or something, it's like blood clots. And I opened up that on my screen, and I guess I was on the Guardian or something. And I was like, blood clots, where is this coming from? So we're watching that. And we were on a meeting the other day with Bill Raska, who's one of our pediatric infectious disease pediatricians. He was talking about blood clots, and he says, you know, the press just really take this and run with it, sometimes in a way that's not responsible. And that because he looks at it from an epidemiologic point of view, he says, we have not seen in these populations where there's more blood clot events than you would expect from any old regular period in time. So if you would compare March 2021 to March 2019, we had people with blood clots then, we have them with now, and it's not an over what we would expect. So he was saying these are safe. He encourages everyone to get them. And if people are reading stuff or experiencing stuff and obviously have some personal health issues, please call your physician and have a good conversation about deciding about getting the vaccine. So that would be like the general advice on that.
Thank you. I have one quick question for Sheila. I think she has to go in a moment. And the question for you is, are you aware of any upcoming requirements from the CDD about keeping vaccine record on file for employees?
I absolutely am not. And yeah, no.
Thank you. I think, we're just trying to, I think people are just sort of thinking about all the things.
Yeah.
And so while we had you here, it seemed like the time to ask. So really appreciate that you could join us today. And I'm going to see if we can squeeze in like one or two more questions. But if you have to go, I understand. Thank you.
I do. I'm sorry. I do have to join a 2 o'clock meeting around the CURSA grant. And so I don't want to be late for that. But I do thank you for the opportunity to join all of you. And I'd be happy to come back anytime in the future. And you do have my email address if you want to send questions.
Thank you, Sheila.
Bye-bye now.
Bye-bye. So there were, I think folks were really glad for the camp guidance and also for the vaccine information. And when the slides are posted, everyone will have all the live links on that and certainly the vaccine information. There were a couple of questions that related to which vaccine at which sites. And so is it clear when you sign up which vaccine you are signing up for?
My understanding with the school run clinics is that you don't sign up for a particular vaccine. I think that if you are registering through a pharmacy, my understanding is there may be choice through that registration process.
Okay, and so it's not necessarily different for early childhood educators.
That's not my understanding.
Okay, thank you.
If anything, it sounds like there might be more choice.
Okay. There are a number of other questions. Some of them are about conditions and health conditions and questions about the code requirements, and also I think 3 or 4 questions that get at the camp guidance. And one of the things that I would note is that actually there are quite a few early childhood programs that have some version of a camp. They either have summer programming that they call camp, or they have camps that they do during school breaks. So that's that's stuff that people are really grateful to have. So we'll share the remaining questions with you. And I want to, Kathy, if you can go to the next slide that just shares the link. There you go. So you can always reach out to the Vermont Department of Health, where you can access people on the warm line. You can access information at the website, and they really want to answer your questions. And you can leave a message anytime. So, and they'll get back to you. That's the great thing. With up-to-date information. We also at Let's Grow Kids post the full slide deck immediately or shortly after we're done talking here, and then we'll post we send the leftover questions to the nurses. They answer them, and we post the answers as well. Thank you so much for participating today. I'm sorry we went over by 1 minute. When there's a lot of information to share, then sometimes we don't have time to get to all of the questions, but we certainly will answer them.
Yeah, we'll get feedback.
Yeah, thank you, Sally and Margaret, for presenting.
Thank you, Brenda, and everybody at Let's Grow Kids.
You're quite welcome. Have a great afternoon, everyone.
Bye-bye.